So with that, I'd like to welcome in my dear friend and colleague, Michelle Steege. Michelle is a physical therapist and has some fancy orthopedic certifications. She works as an outpatient physical therapist at Motion Physical Therapy. There are two Motion clinics, one in St. Paul and one a short jaunt away from General Mills in Minnetonka, right by the Crosstown Lifetime. Michelle has her orthopedic clinical specialist designation. She's a doctor of physical therapy and also is a fitness guru. I lean on her heavily for some of my my patients that need more weightlifting help with mechanics or when they have questions about that. But on top of all of that, she's also an expert in bike fitting and holds a certification with bike fitting. So I lean on her for those questions as well. Just my plugs for physical therapists doing bike fitting. I know most people can take their bike to their bike shop and get the bike fit. And I think that's great. And maybe Michelle can comment on this when I'm done giving my spiel. But what the difference is by seeing a physical therapist for bike fitting is they're going to be able to take into account that human factor a bit more. They're going to be able to, oftentimes when I send people to Michelle or bike fitters who are physical therapists, they'll say, hey, this individual has, this diagnosis, and she will understand all of that and be able to comment on those things. And in fact, oftentimes we'll give people different exercises to help them on the bike or something that I didn't think about. So she's not only an expert bike fitter, but she's an expert in the human body and the biomechanics there as well. And that's where you get a little extra depth by seeing a physical therapist for bike fitting. So with that, Michelle, I'll open it up to you and I'll let you comment on anything I didn't cover with that introduction. And we'll go from there.
Awesome. Thank you, Matt. Sorry, it is a little echoey in here. So let me know if you guys missed something or if you can't hear me. So like Matt said, I'm Michelle. I've been bike fitting for about a year and a half to 2 years. Been a physical therapist for over 5. So I like the bike fitting because, like Matt said, it's an interesting way to bring together the expertise that I have as a physical therapist, but then also looking at the bike and trying to figure out how that specific person can be comfortable on the bike, because not every bike is the same and not every body is the same. And so I think that's the one thing, is that as a physical therapist, we can bring a little bit more of an art to the bike fitting and just understanding if someone has a specific injury or a specific history. In addition to seeing someone on the bike, a lot of times too, we'll do an examination with them, looking at their hip mobility, knee range of motion, or whatever it may be that they're coming in for. So I would say a majority of the people that I see do have some specific injury or past injury that has limited how much or how well they can be on the bike. But also too, I've seen plenty of people who just have never had their bike fit and want to be comfortable on it. So I want to go over a couple things initially today that I think are super simple things that you can do on your own to make your bike more comfortable, and probably some of the things that I see most commonly that can be changed. And so I'm going to go over those, and then happy to answer any other questions or cover any other topics that you guys would like to today. So I have my bike set up on this trainer here behind me. And so I'm going to show you a couple things that I like to have people do on their own, or some of the first things I look at in the clinic. So one of which is going to be seat height, which is obviously the most common modification that people will make to their bike, and is something that you can easily do on your own. And so knowing what that seat height should be at for you. The other thing that's less common for people to look at is going to be the angle of your seat. So just kind of looking at my seat from farther away, you never really want the nose of the bike, so the bike or the end of the seat that's closest to the handlebars, that should really never be higher than the back part of the seat. And this is something that you can look at on your own. The biggest thing that you want to make sure is that your bike is on a level surface when you're looking at that. So if it's not on a trainer, usually having like a wall that you can rest it against so that it's level, or have someone help you to look at that. we have a giant level that we'll actually use to make sure that the entire bike is level before we check the seat height. So I'm just gonna kind of go through those two things with you guys, and again, interrupt me if you have any questions. So first, if we're looking, so this is that big level, so usually in the clinic what I'll do is just see from the back to the front wheel.
Hey, Michelle, can you move the camera a little bit closer? Is that going to be okay?
And
there,
so
great.
From here, so I will put it at the front and the back wheel, and then I'm just looking to see if it's level. If you don't have something like this at home, just using like a board or something that's flat, and then you can download, on most phones, you can get an app that actually gives you a bubble level, or it might even have numbers on it. And I use the one with numbers for when I'm checking the seat angle. So I'm gonna make sure the bike is level, and then I'm gonna go to the seat just with a clipboard on top of the seat here. There we go. And then I just pull up this bubble level on my phone. So I put that there, and then it gives me a number. So it's 3 degrees, and I know just based on the reading of it that, and just looking at it too, that angle is down, so my nose is a little bit below the back part of the seat, which is where we want it. So you want that to be parallel.
Can you show us that app a little bit closer, Michelle? Yeah. Okay, cool. Okay, so great.
This one's called Bubble Level. So
okay.
Handy in other ways. So between parallel, which would be 0 degrees, or a maximum of 5 degrees with that nose pointed down. And that I'll have different reasons for different people on how much that angle is, but also it comes down to primarily just comfort. Okay, and so that's the first thing. I'm gonna bring you close up to my bike just to kind of show you where those, where you would make those modifications. And every bike is a little different, but where you'll find that, so mine has 2. So if you're looking at the back here, there's a screw here and here that I would adjust. It also is gonna be where I would change the positioning of my seat forwards and backwards. But that's also where you can make changes to that tilt. And then if I'm gonna change the seat height, that's gonna be down here. So that's what we'll look at next.
You need a good Allen wrench.
So it's a hex, yep, so it's a hex wrench. Depending on how fancy your bike is, if it has carbon, you may want to look into getting a torque wrench, which is just going to ensure that you don't over tighten. And most bikes, if there's a situation where you wouldn't want to over tighten on or near the screw, it would actually say in Newton meters the force that they want you to like stay below. If it's just like an aluminum frame bike, you don't have to worry about that as much, but just basically making sure that you're not over tightening things. So I'll show you, probably the easiest thing to get to make modifications to your bike is these I don't know what they're even called, but they've got like multiple different hex screws, they've got Phillips screwdriver, all sorts of things, everything that you would need.
And maybe we can put a link up to a common one,
yeah.
If people are interested in that. Okay.
Provide a cheaper option for a torque wrench too.
Okay, great.
So, any other questions about that seat angle right off the bat?
Doesn't look like there's anything coming in, so.
Okay. So we're gonna look at seat height next. So if I hop on the bike, so the easiest way, if you're looking at the seat height on your own, when I'm pedaling, I want the ball of my foot. So if I find the ball of my foot on my big toe and then the ball of my foot on the little toe, if I put my fingers on those, between those is kind of right where I would want the pedal or the middle of the pedal to sit. And so that's where I would place my foot while I'm pedaling. At the bottom, when I'm in the clinic with someone, I'm measuring this angle at my knee. So the bottom of my leg, top of my leg, and that angle I want to be between 25 and 35 degrees. Now at home, you're obviously not going to measure this on your own. So an easy way to look at this is when your pedal is at the most bottom part of the stroke, so like the 6 o'clock position, if you move your heel to that pedal, my legs should be pretty darn straight if I put my heel on the pedal. And that's just a simple way that you can check that seat height. If you put your heel on the pedal and your knee is pretty bent at the bottom, you probably need to raise your seat up a little bit. If you can't even reach the pedal, your seat might be a little bit too high. I would say more often than not, I'll end up moving people's seats up. They typically have them too low. So their knees are too bent throughout the whole cycle, okay? And again, you would just change that with a hex screw there. As far as the different types of bikes, if you have a road bike and you're a more aggressive rider, you may end up having your seat a little bit higher versus if you have a mountain bike. Those are typically kept with the seat a little bit lower. And part of that is for handling, and then also just the fact that if you're on a mountain bike, you're probably in and out of the saddle more, depending on the terrain that you're on.
What about just like a hybrid bike, somebody that's tooling around for fitness and, you know, hitting the trails?
Usually like around 30 degrees is a good place to be for that.
Okay. And so that bottom at the 6 o'clock, at the bottom of that stroke, if your heel's firmly on that pedal, your butt's firmly in the seat, that's probably a pretty good seat height.
Exactly. Yep.
Okay. Okay. So we have a question coming in from Sherry, Michelle. And she said, how can you determine where your seat should be front and back versus angle?
Awesome. Yes. So what I look at when I'm trying to determine how far forward the seat should be is with my foot at the 3 o'clock position. So can you see that okay?
I think it might need just to go down a little bit.
So you're going to bring that
Perfect.
to the 3 o'clock position here. And from there, typically in the clinic, what I'll do is have a plumb bob essentially at just below the kneecap. And if you let that plumb bob drop down, it should fall essentially between the ball of your foot and the front of your toes. And so here, I'm probably on the edge of being a little bit too far back on my seat. I'm on the edge essentially. I could definitely move my seat forward a little bit so that if I have that plumb bob here and it drops straight down, I'm somewhere between the ball of my foot and my toes.
So you could maybe just use, if you don't have a plumb bob, like a yardstick coming off just to guesstimate where that should be, correct?
I've used, instead of a plumb bob, even just having like a string and just tie something on the bottom of it.
Right, of course. Okay, yeah, smart. Okay, great. Well, hopefully that answers your question, Sherry. Let us know if it doesn't. We have another question from Diane, which is a great question. She said, coming from a former long distance runner, and it sounds like Diane has a little arthrosis in her knees. Does the seat height change if you do have, you know, a little bit more arthritis in your knees? Yeah,
so it's going to depend on what your mobility looks like. So if your knee is stiffer, it's going to depend on if you have difficulty with straightening your knee fully. I would say it would have to be a pretty significant limitation for that to change the seat height. But if you're having trouble bending your knee fully because of pain, or if that bend in the knee is limited, that would probably lead me to have the seat a little bit higher so that when your foot's at like that 12 o'clock position, you're going to be in a little less knee bend than you would be if that seat is lower. And I would definitely make a similar change if someone had some limitations in their hip mobility. I just had someone this week who was having hip pain, has some arthritis, brought his bike in, and his seat was pretty low, and we moved his seat up maybe 1.5 inches, and that completely took away that pain while he was biking. And so it was the fact that when he was at this upmost position, his hip was a lot higher because his seat was lower. And so that was what was irritating the hip. And so once we moved the seat up a little bit, it just gave him some more room to work with.
That's great. So any other questions, you guys? Just either unmute or you can pop them right in the group chat here. Michelle, I do have a question for you, unless there's something else you want to cover. Is, you know, some people use clips.
Yeah.
And that they actually lock into their pedal. I know people go to spin classes or cycling classes will do this, indoor cycling classes, but and then some people do and some people don't when they're cycling outside. What are the positives and negatives of a clipless or non-clipless pedal?
Yeah, so the clips are definitely, you're going to see those in people that are more elite riders, doing a lot more aggressive riding, maybe racing. And so the benefit of having the cleats is it basically just makes you one with the bike. And so you can develop a lot more power. And so you can be a little bit more efficient. You can use some different muscles a little bit more. If you think about your hamstrings, bend your knee. And so if you don't have clips, those muscles don't get used quite as much, because if you pull your leg up, they're going to come off the pedals. And so it allows you to develop a little bit more power when you're biking if you have those clips in. I would say most people that are doing more leisurely or recreational riding, where they're not as concerned about like how fast they're going and their time and speed, then no clips is a reasonable option. I don't have clips on mine. I am more of a recreational rider, and so it's comfortable for me. And the benefit of not having clips is if you have to stop quickly or get off the bike quickly, you can do that faster than if you have to get out of your clips. So there's a little bit more risk for falling, or like if you have to stop and you can't get out of your clips, you're going to fall with your bike. So once you get comfortable with them, obviously that becomes a lot easier. They do actually make some pedals that are hybrid. So one side will have clips, but if you flip those, it's flat. So, and I think those are great if there's people who, if they're trying to go for a harder ride and they want the clips, they have them. But if they're just going out for a casual ride, then they can, just use the flat part of the pedals.
Perfect. So
Michelle,
that makes their bike a little more flexible.
I have a question. Do you have any thoughts on, like, there's a toe cage pedal where you could wear your regular tennis shoes? Like, is that just a waste of time and money and I should invest in the clips if I wanted to?
I would say so, yeah. Personally, I'm not a huge fan of the toe cages, and I just think if you really want that added benefit of being more attached to your bike, I think it's worth getting the clips. And most bikes that have the flat pedals, they usually have pretty good grip too, especially if you wear a shoe, whether it's a running shoe or I like wearing my Keens actually on my bike too, because I think that gives me a good surface and good contact. So I've seen, I see the toe cages occasionally, but they're not, I don't think they add enough that if you really want to go for it, I would just get the clips.
Perfect. Thank you.
So there's another question coming from Diane. I do have a question about clips I want to come back to, but I want to ask Diane's question first. Does handlebar height matter?
Yeah, so I would say it's a little bit more of a personal preference. And so if we look at my bike, so when I'm looking at the height of someone's handlebars, I'm looking at how much they're flexed through their spine, so through their lower back. Usually we want that between like 40 to 60 degrees. So if you think about like a 45-degree angle, that's kind of the norm or common spot to be, is that my back is flexed forward around that angle. So you're also looking at what's happening at your shoulders. And so when I'm modifying the handlebars, those are the two big things that I'm looking at. And so the height of the handlebars is going to depend mostly on the kind of riding that you want to do. I've had people look more upright like this if they've got more of a cruiser bike and they feel more comfortable being upright. If someone's on a road bike, they're typically going to be in a little bit more of an aggressive position. And again, it's this more aggressive position where you can develop more power. But if someone has a pretty aggressive position for their road bike and they're having a lot of neck pain, I may try to raise their handlebars up a little bit so that they're not here and then having to do this, but they're more here and can control that neck positioning a little bit better. That's
great. Okay. So Diane, just thank you for that. I think the one other thing, just from a question I would often have as well, before I get to my other question, is if you're looking at bikes and I'm looking to purchase a bike, how do I know what size to get? Is there any just general guidelines for that?
Yeah, so they have, depending on the brand that you go with, a lot of them will have like a small, medium, and large or extra large size. Some of them will go by different measurements. And so I would say if you're getting your bike from a shop, they're going to do a great job of putting you in the appropriate size. And there's definitely, kind of like clothes, there's definitely those people that could go one way or the other and be comfortable. And so I think typically if you are kind of in the middle of sizes, going up probably gives you a little bit more room to work with as far as other modifications. And so if you're looking at a bike at a shop, they're going to do a really good job of getting you the right size. As a rule of thumb, if your bike is on the ground, so it's not really going to work for mine because my bike is not on the ground, but if it was on the ground and I was standing over it like this, I would want at least an inch or two from the bar to my inseam essentially. And so I would want at least an inch or two of gap between me and the bike. That's going to vary. Like women's bikes, a lot of times the bars will go down lower. The purpose of that is that it just makes this part of the bike a little bit more compact, just to try to fit the female frame a little bit better. This is actually a men's bike, so they definitely, if you're a woman, you don't have to get a women's bike. And so if that frame goes really far down, obviously that's not gonna be what you're looking at. But when you're standing on the ground, then it should probably be just a few inches for you to get up to the seat. But I would say in general, if you're getting a bike from a shop, they're going to do a good job of finding you the right size. And I've seen a ton of resources online for helping you figure out based on your inseam. You can also take a measurement of your inseam, which will help you figure out the right size bike for you. REI has a good resource for that. There's some other ones out there too.
Awesome, thank you. Well, we're kind of winding down already. Holy smokes, that goes fast. Does anybody else, before we start kind of winding down and closing out, have any other questions at all? I haven't seen anything else come in, which is fine. I know sometimes you may have some questions after you've digested this stuff. The only question I'll have, Michelle, is I know you touched on the main points with the seat height, and that's usually an issue that people can correct on their own at home. But what's the number one injury that people seek your services for on the bike, and just like one modification outside of the seat height that people have issues with that's pretty easy to fix?
Yeah, so I would say most lower body injuries can be related to, even if you've got the right positioning on the bike, sometimes the mechanics of how you're moving on the bike are something that I always will make people aware of. And I'm going to move the camera to the front of the bike to show you that. And so if I am watching someone, and a lot of times I'll take video from the front of the bike, and so whether someone's coming in for hip pain or knee pain or something like that, if they're pedaling, I'm watching to see if their knee is staying in line with their foot throughout that cycle. What I commonly see, and what I commonly will then change, is that people tend to ride with their knees closer together like this. And it gets you using some muscles that aren't the strongest ones that you can be using for biking, and sometimes that can lead to some overuse injuries. And so I often will have people pay attention to that, where they are being aware of keeping that knee in line with their foot the whole time. If they have cleats, sometimes that means that we'll move the cleats in or out a little bit so that it's in a good position for them.
Okay.
And then as far as upper body stuff, the other thing that I see often is that people overextend their wrists on the handlebars. So whether you have a flat handlebar, your wrists end up coming this way a lot, or if you're on a road bike, you end up coming like this. And that's when people can get a lot of symptoms in their hands, numbness, tingling, pain. So paying attention, trying to keep that neutral wrist position, as well as keeping your elbows soft so that you're not locking out your elbows.
So key points are keep your knees over your toes. If you can't do that, come in for a bike fitting, and keep your wrist neutral, right?
Got it.
And elbows soft. So Michelle, then just so people understand, as I understand it, please correct me if I'm wrong, is that if they have a working diagnosis and a referral to physical therapy from their physician, that you could actually run this through insurance, right? Through their insurance.
Yep, absolutely.
Yep. Otherwise, if people want to come in and just pay cash, how much does it cost to have you set me up to keep me injury free on my bike?
Yep. So if we're just doing insurance, we can bill that because it's something that is impacting pain or causing pain, and so it's justified in that way. If we're running it through cash, we offer a 40-minute or an 80-minute bike fit. So the 80-minute would be much more elaborate. Most often those would be for someone who has a road bike, is doing a lot of biking, has a lot of things that we're looking at as far as modifications and really tuning into the fine details. A 40-minute bike fit usually is sufficient for someone that's more of a recreational rider. And a lot of times if we do the 40-minute, start with the 40-minute, and then we're like, hey, maybe we could look at something else, you can always come back in for a second one. So the 40-minute is $160, and the 80-minute is $180. Or I'm sorry, $280.
Okay, great. Well, I know we're running out of time on our Zoom here. If there's any other questions, please ask now. And again, we can get you in contact with Michelle if you have questions going forward. Join us next week for our Q&A Fitness Wellness Wednesday, whatever we're calling this. We're going to talk a little bit about fitness apps. And thank you, Michelle, for your time and expertise. It's been a pleasure as always.